Thank you, Dr. Altheimer, for that great address and also action items that we can take away. So it's good that we have some action items that we can look into. But if you're free, we'd like you to stick around for our next panel discussion. And with that, I'd like to introduce our moderator, Chiara Smith, who has experience in violence prevention interventions. She is a program officer at the Greater Rochester Health Foundation with more than 20 years of experience within the nonprofit and human services industry. Smith currently serves as co-chair for the Community Voices Network at United Way, as well as the Health Foundation's Change Team.
Is Sierra here? You're muted, Sierra.
My apologies. I'm in the office. Can you guys hear me? You can hear me?
Yes.
Thank you so much for that presentation, Dr. Ashad. It's always good to hear from you and to learn from you. And I hope that everyone is taking notes so that we can apply what has been told to us today. I'm excited about this panel. Thank you guys so much for giving me the opportunity to be the moderator today. So I am going to get started and introduce our guests. We have Deputy Chief Keith Stith. He has been in law enforcement professional for over 30 years. He currently works for the Rochester Police Department as their Deputy Chief of Police that oversees the Community Affairs Bureau. He is an expert on urban policing and advancing 21st century policing principles. We also have with us Cathy Thomas. She has over 35 years of experience working in the human service field with an emphasis on, but not limited to, advocacy for underserved children, youth, and families in the juvenile justice system, and currently serves as the Chief Youth Development and Engagement Officer at the Monroe County Youth Bureau. We also have with us You also have with us Victor Saunders, is currently the Special Advisor on Violence Prevention Programs to Mayor Malik Evans. Saunders has nearly 30 years of experience in youth development and violence prevention and brings an extensive experience in crisis prevention strategies, youth intervention, gang specialization, dispute mapping, and trauma-informed intervention. So thank you all and welcome to the panel. I'm going to give my first question to Deputy Chief Keith Stith. Am I saying your name correctly? Your last name?
It's correct. Yes, you got it right.
Thank you. So you were brought to this community with a track record in New Jersey. Can we talk about your vision and 2 key violence prevention strategies you hope to implement in this community?
Yeah, so thank you, Ms. Beth. So I like to say I'm a product of my experiences, and my experiences have taught me that public safety success is relied upon by its citizens in the community. I don't think any law enforcement executive should have a singular public safety vision. I think that that vision needs to be a co-production, which means that the citizens and the citizens of Rochester should be working together to develop a public safety vision. Because it's important, because the citizens of this city they are valued, and they should participate in shaping and strengthening their community and creating change. So with that being said, the last 4 months I've been here in Rochester, I've been on a listen and learn tour and holding community events so I could get input to create a community engagement model that is, number one, community driven, culturally relevant, and responsive to the true needs of the city.
Wow. Thank you so much for that. My next question is going to go to Catherine, and I'll get back to you, Deputy Chief.
Sure.
I have some additional questions, but for the sake of time, and we're going to move forward, and then we'll come back to those things. But for Ms. Cathy Thomas, we're seeing a heightened level of violence committed by youth who are very young. What are some of your suggestions to prevent this from happening?
Thank you for that question. I will be quite honest. I don't have any informed response to that, but what I can share with you, an African proverb that came to mind for me is: a child who is not embraced by the village will burn it down to feel its warmth. I really feel that there's such a disconnect with our children today. There's the absence of the village. And until we get back to the village mentality, I think we will continue to see this disconnect in our community, where our youth are reaching out to what they see, what social media, and that's what they're latching to. The village needs to take a more responsive, as the empower equity and accountability to our young people. That's my response to that.
100% agree. 100% agree. I believe that that's what's missing. I believe that that's what's the problem. The problem that we're currently experiencing is due to the absence of a village. Victor Saunders, the access to guns and the use of guns to commit various crimes have become the norm. What is your department doing to address this crisis, and what progress has been made?
Well, first and foremost, thank you for having me this afternoon. As far as it becoming the norm, the young people that are in our communities most affected by violence are resilient, and they are individuals that, as challenges arise, they seek to find and respond to it in a way that they figure they're getting the answer. Unfortunately, a lot more of our young people have access to firearms, which is something is at a level that we've never seen in our community before. Out of our office in particular, the biggest thing that we do in the Office of Violence Prevention Programs is build relationships. We build relationships, we communicate with these young people, and we attempt to get a level of trust in a way that they know that we are trying to look out for them. We want to hear them. We want to give them a voice. We would not want to believe that a young person that doesn't have access to a positive adult to share in their life, that it's still not a possibility. We try and put resources and opportunities in the hands of young people that could assist them in changing their mindset. And that's the largest component of the work that we will do, is offer alternatives, offer an opportunity to learn how to manage conflict, learn how to de-escalate a situation within yourself. We have some very intelligent young people, and the fact that some have chosen not to use their words in a way of dealing with conflict is a major issue for us in our community, and the reason for a lot of the violence in our community currently. We've had numerous things to occur that would escalate the violence in our community within the last few years. Like you heard Dr. Irshad speak on the political unrest and after the death of George Floyd, as well as COVID. But a lot of that was just adding to the adverse childhood experiences that our children in our target neighborhoods have had to deal with since birth. We hope that through the work that we're doing within the school and our school-based team, and expanding more full-time workers in our school-based team, and expanding our street team to be able to work with more young people, offering them more enrichment opportunities and opportunities to be able to just be in a safe space and share of themselves and allow themselves to receive a message of peace, will help us to move beyond this circumstance.
And thank you so much. I think that yourself, along with Anthony Hall and Pathways to Peace, have been doing phenomenal work, along with some of the other agencies that are out in community. So thank you guys for the tiring I mean, not the tiring work. Well, it is tiring, but just the endless job that you guys are doing to
Thank
help
you.
make a way for our young people and to ensure the safety of our community. Deputy Chief Keith Stith, I want to know, we know that we know what the numbers tell us, and we are seeing nationally and locally from a system and community and individual perspective, but what are we missing?
I think that actually the magic is in the work. The work is in the community, and the solutions are in the community. You know, I can share with you the challenges that I'm having coming here, being new to Rochester. There's a lot of silos in the city. What I'm learning to do is, the way I manage silos is that I create the agenda and invite people here to the public safety building. We have to get away with thinking that the public safety building is a bad place. So I want to change that culture. But I want to be the person that facilitate these groups, get all these groups under one roof, and come up with solutions to address some of the problems in the city.
Thank you so much for that.
Thank
And I'll finish what my mind just started going haywire, but thinking about what Dr. Irshad said about in his last speech about the need we have to bridge the gap between community and law enforcement. And that starts with having a real honest conversation about what happened prior to Daniel Prude, after Daniel Prude, and just have some apology, some atonement with community between the two. And I think you're absolutely right, is that we have to begin having that conversation, and then having some sensitivity training around the disconnect between the community and policing. So thank you so much for bringing that forward. Ms. Cathy Thomas, what can we do to address the trauma and social emotional health of our children who are seeing and hearing violence happen at their doorsteps and even in school and in their homes, outside of their homes? What can we do?
It seems like, as I thought about this question, it seems like the community at large has begun to normalize these acts. And I think that's where it has to start. We have to address this trauma as it occurs with these kids. I mean, there's oftentimes the barriers of having to wait. A youth that has been traumatized by an event, an act, and has to wait a week, 2 weeks, 3 weeks to get counseling, to get that trauma addressed. In the meantime, that person is continually that trauma is continually revisiting. That youth is having to experience that because it hasn't been dealt with. And then you add the family into it, okay, that most of these young people that are impacted by this trauma has raised by a single parent, grandparent, and I'm not singling out because the crime, as we know, is across the board. It doesn't have any specific, but for those families that are just one parent that has to go to work, that has to do this, that has these different commitments, and then on top of that, having the commitment to try to get these youth to counseling and insurance and those barriers. But the main thing is that we cannot continue to normalize like it's okay, because it's not okay. It's just not okay.
I agree with you 100%. I believe, especially in our community, yes, in our community, we're so used to, I live in 14621. And so gunshots are we're no longer like jumping necessarily, right? It's like, oh, I just heard 5 shots on Avenue D, just go on Joseph, So you're absolutely right. We have to find a way to desensitize community as it pertains to violence, and then the long-term impact that it's having on our children. And I think of the African proverb, how are the children? Are the children well? you know, and then what is our response to that? And in our case, the children are not well. And if our children are not well, then that means that our community is not okay as well. So Dr. Ashad, is there anything that you'd like to add to that?
I think one of the interesting things to really reflect upon is how do we prepare the broader community to better treat our own trauma, right? So the counseling is very important. Going to mental health professionals is very important, but I don't know that we have any kind of plan to say we're going to train 1,000 community members on how to deal with their own trauma, but also help young people with their trauma. And I mentioned this, I think some of you who know me know that so about 25 years ago, I was shot, and it was a mistaken identity, and I was shot, and my best friend was killed. And I always tell people that, the hospital did a good job patching me up, but they just sent me home, right? And we do a little bit better job now, but it was the village that came and took care of me. And so I think that we need to think about equipping the community. Government's important, nonprofits are important, but what are we doing collectively to say, here's a toolkit, a community toolkit to help the community process and deal with this trauma as we try to deal with A, B, C, and D. And I think we're a little far off from that, but I think that's something we should reflect upon.
Absolutely. And for those who may not know, Dr. Ashad and I are working closely along with some other community partners to come up with a way that we can better have a clear understanding of what's happening on the ground. When he talked about that mapping of community services and knowing who's doing what, and when someone gets shot, like, do we send them to Healers Village? Do we send them to Pathways to Peace? Do we send them to Wanda Ridgeway? Do we send them to 585 Snug? All of those things are important. And so when you talk about Deputy Chief Stith is here, and he's able to recognize the silos in our community, even amongst those of us who are striving to do the same things. It's really important that we collectively work together, pull our resources together. We have more resources now than we've ever had. When my aunt Audrey Smith and my aunt Maudine Brown were doing this work with nothing, right? When they were frying chicken for families out of their own pocket. And now we have millions and millions of dollars simply focusing on crime and prevention and intervention in our community. And I think we can have better results. And for those of you who don't know, I worked for Action for a Better Community, which is why I have this orange ribbon on. It's representing gun violence awareness. And I actually started this while at ABC to bring about awareness. And when I was there, we were able to get 367 days of non-gun related homicides in the 14621 area. So we have a model. We know, I don't want to say that we have a model. It's the person who works the model, right? That gets us the results. So I think partnering with one another and asking questions of how we can go back to making our community safe again is going to be vital to getting some results. Mr. Saunders, it appears that many of our Black youth have moved beyond the inability to solve conflict in a healthy, safe manner. As we discuss prevention, what should we be prioritizing?
Having worked in the schools the last 6 years and on the streets for 16 years before that, I recognize that you can't exhibit what you don't know. A lot of our young people have never been put in a situation, have never learned it in a household that aggression is always met with aggression. It's never met with a calm word or de-escalation. A lot of these young people have never learned that. I think for myself, what needs to be prioritized and what I know what needs to be prioritized is social emotional well-being of our young people. The ability to be able to communicate and what positive communication looks like. Out of our office, a large component of what we're doing more so now is utilization of our intergenerational mentorship. Understanding that elder circles having an opportunity to communicate with these young people and allow them the opportunity to communicate back to you. More importantly, being able to just be a listening board for these young people to be able to get some of this stress off of them. Like Ms. Thomas stated, we are a lot of times getting paged to the hospital when individuals get shot or stabbed, so that individuals aren't treated and treated like Dr. Ershaw was previously. And in communication with these same young people, if they don't have an opportunity to talk about their trauma and the stress around it, like Elder Hanif always says, you know, some of our children are screaming out through the barrel of a gun in some cases because they're not being heard otherwise. So being able to have a positive adult in the life of a young person, just to have access to them, to be able to allow them to share their grief, their loss, and the traumatic experiences they've had to grow up with, goes a long way. I think the social emotional well-being and being able to discuss what empathy looks like. What is empathy? What does empathy look like to you? Being able to put yourself in someone else's shoes, and try and work against and teach against this idea that our kids have been totally desensitized to violence. You know, we have a lot of reteaching to do as far as our young people are concerned. And all the time that they were locked in, and all the time that they weren't able to physically be around peers and exhibit those human connections, has worked against them. In a lot of ways, they were getting their cues. They get their cues from their peers. They're not getting their cues from people who have lived this life. So they're getting their cues from individuals that don't know no more than they do.
Absolutely.
And they running with that. And it's unfortunate, but it's incumbent upon us as the carriers of understanding, the ability to be able to peacefully handle a conflict, to be able to teach others how to do this. We have children who have been traumatized well before COVID and continue to be. Have been traumatized well before the George Floyd incident and continue to be. And a lot of them have never received assistance in dealing with that hurt. And when you have children walking around with traumatic experiences and hurt like that, and then you put a firearm in the hand of that young person, not to mention mixing, substances that, are far beyond their years in their little bodies, anything is subject to happen, and that's the biggest thing I think that needs to be prioritized, is their mental well-being, allowing them safe spaces to be able to exhibit their vulnerability. And that's something else. That's something else specifically to young African-American males, being able to show vulnerability and not take it as showing weakness.
Yeah.
And that's huge. And, if you don't have a man tell you that, a man that cares for you and is concerned about your well-being, you will internalize that in a way that you'll be telling your child, you can't cry, things of that nature, antiquated thought patterns such as that. And, those are the things that I think will go a long way. And we really have to really prioritize. And the doc sort of said it tongue in cheek, but I believe 100% that we need to take a big chunk of these millions of dollars that we have made, that the government has made possible for us, and definitely dump a chunk of that into people that have a commitment to being able to assist our young people in moving beyond the hurt and trauma that they feel, by being trained to work within the community with the targeted population.
Absolutely. And I think one of the things I want to say, Dr. Ashad and I talk about this all the time, along with Anthony Hall, and that is that people automatically assume that everyone can do this work. and this work isn't for everyone, right? The
Right.
credible messenger model, everyone is not a credible messenger just because you live in the hood, right? So I think vetting those individuals, and not just because they went to prison, it doesn't mean that they are ready to necessarily be a credible messenger role model in this space. So, but absolutely making sure that we are lending funding to train those individuals who are ready and prepared to do the work is an absolute necessary. So I have another question. I guess this would go to Ms. Thomas then. I'm curious, we hear Mr. Saunders discuss the importance of engaging our young people. So I'm curious, I'm curious with the county, the county's opinion on how they intend to engage the youth.
Well, I want to say I agree with everything that Mr. Saunders said. Very much important about relationship and for these young folks. And one of the things I have to say to go back is that out of all the things that we try, we need to get back to the days of the Bible. When there was Bible study, when there was activities, there were camps, there was choir rehearsal, all of that seems to have gone by the wayside. Now, some of it, COVID has taken part to that, and then the mentorship. In the church, there was mentors, there was the deacons and there was youth pastors. There was that mentorship. Our young people need to be mentored. When I speak anecdotally to a number of young people, the common factor is the absence of a father. And I'm not saying, and I'm not discounting that youth cannot be raised by a single parent or mother, but the missing is that continuity of having that man, that father figure in their lives. That's a key component. And I look at other factors is the trust factor. Even with our mentors, even with all of our different programs, the lack of trust. How many times will a youth tell their story? How many times can you expect them to tell their story? And the whole trust factor. And it's not every youth out there that doesn't want to do well. It's just that having that support, having, as we talked a little bit about the village is so important. It used to be Big Mama. Big Mama knew everybody's kid, everything that was going on. Kids were comfortable going to where's the Big Mamas? Where are they? You know what I mean? These are real things that happen as we look back that brought us through, right? So we have to get back. And I'm going to stay with, we got to get back to the village mentality.
Absolutely.
One of the things, if I could just jump in real quick, Chiara, one of the things that I think is really fascinating about both Victor and Ms. Thomas's discussion is that, and they're pointing to these important turning points in life where the people on the ground anecdotally can identify the need for intervention, right? So one of the fascinating things and troubling things when you look at some of our young men is if you talk to, for instance, talk to the school resource officer, talk to the person at Pathways, talk to the crime analyst at the Crime Analysis Center. They all said the same thing. He started getting in fights at this age, and he used to be a good basketball player, but this happened. And so there are all these along the life course opportunities and turning points in life. This is both backed up by years of research now and anecdotally what we see from people on the ground. But oftentimes we as a community have not effectively engaged those much troubled youth at those turning points. Mm-hmm. And so thinking about the mentorship and the connecting them to institutions at that point is very challenging. And I think we also have to resist that urge in our community to exclude kids when they start to act up, because that's been one of the things that we've done. So we talk about the youth, but look, we have zero tolerance everywhere. They get in trouble at the rec center, they can't come back. Get in trouble at the library, they can't come back. Get in trouble here. And so we have walled ourselves off from them too. But I do think if we think about those turning points as places for engagement and mentorship and trust building, that may be a starting point for us to help deal with some of the young people before. And you think about people like Anthony Hall. I see Anthony's on here. You know, Anthony does a good job. Sometimes he'll post on social media, you know, we met with this person, we met with that person. And it's really remarkable because sometimes just having someone in the community who young people can trust and talk to and shoot some pool with can really help. We don't have enough of those people available in the community
That's, yeah.
trusted at the intervention points.
Absolutely. And one of the things that we need to do is in support of Anthony is making sure that those of us with resources are doing just that. We are engaging that 5% that's tearing our community up. And that's they're hard to engage because everybody can't have a conversation with them. They ain't going to church. They're not going to Sunday school. They're not going to Bible study, right? So you're going to have to go on Hudson and Avenue D. You're going to have to go to the Ville. You're going to have to go on Jefferson. You're going to have to be on Chili, right? We need the Marlon Monroes. We need the Anthony Halls. We need those young people who are engaged in this work to utilize their strengths. And then we have to come up with someone locally. I know Anthony and I were talking about, like, who can we bring here that these young people will listen to and that they can have a conversation with. And I'm just going to put that out there just right now. You know, we want to bring Meek Mills here to have a conversation with young people, to engage them about the reality. What did he mean when he talked about 100 summers in his music? And I think for some of us, you know, I'm 44, so I'm not young anymore, but we have to listen to the music. They're telling us their stories. The stories, it's in the music, right? They're telling us what they need. They're telling us what they're going through. And so we have to be willing to, Anthony brought it to my attention the other day. He said, because I was like, Anthony, it's the music. It's the music. The music is the problem. He's like, you forgot. We listened to X, Y, and Z music when we were younger, right? And our parents was probably saying Tupac, Biggie, Little Kim, you know, and now they have their whole thing, right? And so I had to look at that a different kind of way as well. And because I love like Meek Mills and all of them too. So, but finding a way to engage young people, because we talk about, you know, the percentage of young people who go, these young people, they're not going to the rec centers. So we got to find them. We have to really go out into the community, into the streets, engage them in a different way, in a different process. And that's why I say people think that this credible messaging model, anyone can do it, and they can't, because people want to see the success and they want to see small wins, as Anthony often reminds us, to keep this community engaged. Deputy Chief Stith, police and community relationships will be a key factor related to advancing your work. With various levels of mutual distrust, lack of respect, and officers who lack cultural competence, where do we start to build police community relationships? Where does that conversation begin? And who does it start with? I can't hear you.
You're muted.
I'm sorry, Ms. Smith, can you hear me?
Yes.
I'm sorry. So a couple of years ago, I was asked the same question as a chief of a police department. And so I'm gonna give you the same answers. It's two answers that, well, it's two suggestions I'm gonna give you. Where we need to start by acknowledging and apologizing for historical incidents that had an impact on police-citizens relation. I think Dr. Ashad mentioned that during his presentation earlier. You know, law enforcement executives say that we should have these tough conversations, and we never have them. And we should have those tough conversations in our community. Secondly, what I did is, and it's going to happen here at RPD, we took a hard look at the curriculum in the police academy.
Mm-hmm.
And, you know, one of the classes are the history of American policing. It's not the true history of American policing. So that's another, I'm going to propose that here at RPD, that we talk about the true history of American policing. And I think once cops understand the history, you know, they won't make the same mistakes. So those are, well, lastly, I did implement that in New Jersey. That's going to happen here in RPD.
I'm hoping so. I'm hoping so. Dr. Ashad, can you lean into that question a little bit? What are your thoughts around what needs to happen between community and police in order to develop relationship?
I think that Deputy Chief Stith's first 2 points are important. I think that it needs to also look at, are there particular, I think the training is a good start, but I also think thinking about how does policy and how do promotion practices impact willingness and ability to engage the community in a useful way. I think if you look at police departments across the country, and then we're fortunate to have brother Chief Stith here, but a lot of departments don't even have a deputy chief of community engagement, right? So that's a good part that we have that. But the next point is, how do we ensure that a position like his is a pathway to become chief, right? Because in some departments, you got to only be a certain type of chief or a certain type of person to become the chief, right? So you got to be the SWAT guy, you got to be in charge of operations, and the diversity guy doesn't get to the promotion. So how do we ensure that this position is so valuable that it can lead to him becoming the chief? The second thing, I'm not saying you want that, I'm already giving you the promotion, brother.
Hey, I had that role before. I'm good, man.
The second thing I think is when we have positions like Deputy Chief Stith, how many people directly report to him? Right? Does he have, what is his budget for community engagement? How much of a budget does he really have? How many police department officers can he directly deploy and respond to a particular issue? We have some deputy chiefs that don't have any direct reports. How can you be successful? Don't have a budget. How can you be successful? And and then the second thing is that, is it a requirement for promotion? So if you want to go to become a sergeant, what have you done around diversity and engagement, right? Because a lot of police departments say we value diversity and engagement, but if you look at their training, one of my colleagues who was now at St. John Fisher, Dr. Greg Drake, he's done some interesting stuff on police training, but a lot of times taking certain trainings lead to promotions and taking other trainings don't. So can the work and trainings around diversity and community engagement be valued to an extent that they can lead to promotions? These are other things I think inside the structure of policing that need to happen to make people know that, hey, if I want to make sergeant, man, I gotta be involved in the community.
Yeah. And then how do we as a community support Chief Stith to ensure that he has the backing of community? And then I think one of the things that's really important for me is we talk about diversity, but specifically for me, it's the racial equity competency that needs to be learned within the Rochester Police Department. And where are we when it comes, where are we with that as it pertains to training, and having an understanding of, and then not only, I want more people who look like me, police in my community. I want there to be some kind of incentives for Black and brown people to be police officers within the community. But I guess that's a conversation that we can have offline, Deputy Chief.
Yes.
In regards to that, I'd love to have a bigger conversation around that. Ms. Thomas, the level of violence that we're seeing has an impact on the entire family. Are there any multi-generational approaches to prevention that we should be aware of?
I cannot speak of any multi-generational other than, as I mentioned earlier, around the going back to the church, going back to the community of the church and engaging our young people, and also the trust factor. Years ago, there's always been mentors, there's always been mentorship, but being really intentional, I think that's the piece. We need to be more intentional about working and dealing with the issues that our young people are encountering today.
Thank you. Thank you. I'm just going to go back real quick and I just want to lean into something a little bit more back to Chief Stith, and I'd like to get Mr. Saunders' opinion on this as well. When we think about diversity in the Rochester Police Department, I don't know if you know off the top of your head, or this might be a sidebar as well, is the numbers as it pertains to diversity in our police force. One thing, that's one question. And another thing, a question that I have just as a community citizen, is that I noticed like Section 7 has a police department there. I'll ask that offline. Can you
Okay.
just tell us about the diversity within the Rochester Police Department? Can you talk
Yes,
a little bit more about what that is? What's
sure.
happening there?
So 86% of the police department is white. 93% of the cops don't live in the city of Rochester.
Okay. And as a community, and maybe this is a question for our mayor, how do we change that? Because that's problematic as HE double hockey stick. How do we change that? What do we do as a community? We've been saying this for the longest. I think
Yeah.
probably been saying this since the 60s, since the Joseph Avenue riots, right? How do we diversify the Rochester Police Department? And then because how can we trust, right, that you have our best interest in mind when you don't look like me? I think that's a question that, and just, yeah, how do we diversify? How do we change these numbers? Is it possible? Is it even possible?
It's not going to happen overnight. There's a number of challenges. Where you want me to start at?
I want you to go wherever you feel most
Oh,
comfortable.
okay, so recruitment needs to be community driven, and it has to be. We need everybody at the table to get our Black and brown people to take that test. The other piece is there's barriers in the recruitment process. I'm talking about on the police end that we need to take a hard look at, because some of those barriers are stopping young Black and brown folks to be police officers. There's some other outside issues as well. And we could talk about salary for a second. Towns outside of Rochester pay more than the city of Rochester, so that's a challenge. But we're gonna have to be creative, and I don't know what creative is right now. It's funny that you asked me about that question. I got a meeting with HR tomorrow about recruitment, but we're gonna have to think outside the box to get our minority numbers up. And
I mean,
go ahead. I'm sorry.
No, I was just going to say, I was just thinking about East High School when they had the fire
Yeah.
department program, right, at East High School. So how do we incentivize having recruitment within, because you don't need a college degree to be a police officer.
No.
So how do we incentivize students within the Rochester City School District in becoming a part of the force? Because I know that they do it in other towns, in other high schools, in other spaces. How do we have that for Rochester City School District? I think is a conversation. Again, these are conversations we can have offline, because I'm sure
Right.
you and I will be
contacting
in other ways. But
definitely. One of my priorities is, of course, I want to see RPD footprint in some of these high schools, and currently it's not. So that's a priority to make that happen. But again, it's going to take some creativity to get those numbers up. I mean, just think about this: 86% of the police department is white. It's not going to happen overnight. We need a long-term strategy and plan to come up with respectable numbers.
yeah. Mr. Saunders, can you weigh in on this conversation? Oh, well, you can't because of conflict, so you can't. Ms. Thomas, can you say anything, or you can't either because of a conflict? I do know that we have to really be having conversations about recruitment. I know that we need to also be reviewing the test to ensure that there aren't any bias within the test that prevent people of color from taking the test. Did you want to lean in, Ms. Thomas?
No, I was just going to say, I I pass on a comment to that.
Okay.
Um,
And that's just really important that we really have, I know because of conflicts, that we really have to have, you know, the conversations can't go as in depth as we need them to, but I don't know if it's what kind of forum we need to have so that we're developing a plan so that our police force is reflective of the communities that they're serving. And I think, you know, without a doubt, we need to be screaming that to the rooftops every day and putting some pressure even on the union about what that needs to look like. And again, I know that you guys can't say anything, so
Yeah.
I can say that for you guys. I'll say it for you. Mr. Saunders, you were going to say something, Chief Steve?
Yeah, Ms. Smith, in the near future, there will be, I'm putting together a meeting for everything you just talked about. And so we can have those tough conversations, because you know, obviously I can't do this by myself, so I'm definitely going to need some community support with in terms of trying to change the diversity here in the police department.
Good. Susan Stranger asked, has there been any other cities around the country who have been more successful in diversifying their police force?
Yes. Can I?
Yeah.
So Newark Police Department, let me step back. Jersey City Police Department had a diversity issue. Now it gets tricky because you got civil service involved. So what they did was that they hired provisional police officer. What that essentially means is that, you know, they did a background check. They put students through the academy. After you got out the academy and became police certified, you took the civil service examination. All right. Newark Police Department, excuse me, Jersey City Police Department and Newark, as a matter of fact, were very successful at doing that. Now I'm in New York State. Different laws, different state. So I don't know if that's possible, but you can circumvent the civil service process to increase your diversity in New Jersey.
In New Jersey. I'm going to take another question from the chat really quick before I ask Mr. Saunders this question. Well, actually, I'll ask this question first. Mr. Saunders, you're the mayor's advisor on violence prevention. What are some strategies being used by your team and community partner that have been effective this far? And I also, while he's answering that question, can you guys think of one or two organizations each that you guys know are currently doing this work so that others who are here who may not be aware can know what the organizations are that you guys are working with currently? You're on mute.
Different things that are working. Well, you know, Dr. Urshad will be the first ones to tell you that in an intervention and prevention, it takes time before you're able to even build up the data to show your true effectiveness. This being our first year within our office, I am happy to say that the approach that we took to intervention and prevention, I think, has been very effective in the way of addressing a lot of the core issues that arise, that lend to violence and homicide occurring in the community. When I first started, one of the first meetings I had with the mayor was with Dr. Urshad and another data analyst from MCAT. And in that conversation, I learned something very valuable, that in the work that we've done over the years and being able to look at the data is being data literate in a way that when you are a youth serving professional, you look at the data totally different than you would as if you were in the mode of suppression, which is law enforcement. When you look at the data, it's definitely looking at it from a trauma-informed lens. We have to look at it backwards to frontwards. We want to be able to address all those different issues that have occurred within that individual, or different traumatic milestones that might have occurred that allowed for this type of behavior to have existed, that a person would pick up a firearm and carry out a violent offense. And in doing so, Anthony Hall and myself in the Office of Violence Prevention Programs, we looked at our approach as being more holistic in the way that we normally receive referrals from the community as it relates to negative behavior by individuals within the community. one thing we recognized by receiving those referrals was these people are not on an island set apart from the rest of the world. They're part of a family. They're part of predicate members that they might not even be blood relatives, but they're family. And there's a certain behavior or mindset sometimes within that family that permeates through this person who's getting referred. And in knowing that, we recognize that only working with that individual is not going to be helpful for us to be successful. Being able to work with the family members and predicates around this individual to change the mindset and change the paradigm would be more advantageous for us to be able to be successful as a community. Utilizing evidence-based and data-driven approaches is a wonderful thing if you're utilizing the data and knowing how to access it appropriately. So we recognize that the work that we're doing in the community needs to be able to address a lot of the different social ills that have led a lot of the different situations that have arisen to be able to we have to be able to work beyond those situations in order to help somebody change their mindset. In these same small street segments that we're looking at, the 11 street segments of most of our violent crime, violent assaults that have occurred in the city and homicide, we recognize that these same neighborhoods are the same neighborhoods that have had to deal with issues of structural racism and poverty and drug abuse and things of that nature over a period of time. You and I are neighbors in 14621. I'm preaching to the choir. But we understand not breaking down these different things is not going to help the problem go away. So we recognize we have to address all of those different things within the community in order to affect the change within individuals within it. So I think the work that we're doing with Pathways to Peace and Anthony's team in the school and on the streets is helping tremendously. I also believe that the program that we inherited, Advanced Peace, which I'm happy to say is targeting, like Dr. Urshad said about a targeted group, we're targeting high-risk individuals that were either victims or assailant in gun crimes. Either having done time or being, like I said, being a victim or an assailant. Right now, we, in the work that we're doing around our intergenerational mentorship, have 11 of our fellows, which are the mentees, and 5 of our neighborhood change agents, which are mentors, right now in Montgomery, Alabama, for their transformational travel. And that's part of the program that we have in place. And basically what they're doing down there is learning something about themselves they otherwise probably would never have recognized. And they are at the Slave Museum for the next couple of days. And, these are guys that went down there who otherwise would never even be engaged. These are the guys that don't get engaged. These are the guys that the doc said aren't going to be talking to institutions, are not going to be meeting you at no office too tough or anything like that. Our neighborhood change agents had to go through a lot to build up a relationship with these individuals to be able to get them to a space where they felt safe enough to be able to go anywhere with anybody that wasn't their day ones.
Yeah.
So
what's the difference between because I think there's a difference in what and I know that Dr. Urshad has to step off for another appointment. So I just want to thank you in advance for your time and your knowledge and sharing your acumen with us. Have a wonderful day. Be well.
thanks,
Mr. Saunders, what's the difference there? Because there's a difference between who we're calling them, they're credible. I forgot what you guys are calling them. They're essentially credible messengers, case managers, right?
Exactly.
They're hood case managers.
Yeah.
And so the difference there is that there's the they understand the culture, because
Right.
and I think that's one of the things that we don't talk about is there's a language, there is a street culture, there is a different world that exists outside of these boxes here.
Totally.
And so having someone that can tap into that space, that can bring those individuals and say, we have a language, you understand our language, we don't have to code switch because you
Yes,
understand it. And
exactly.
then that individual can go back and translate to the doctor on their behalf. And so I
Listen,
think it's really
that is
important.
it. That
Mhm.
that the credible messenger piece is gigantic, but to see it in action is even bigger. And not only for the neighborhood change agent and the young people they're working with directly, when we have elder circles and invite other cats from the community in just to sit down and chop it up and share some of their life experiences with some of these brothers, they find they have more in common than they do, not. So, they have more of a sense of accomplishment and sitting in a room with individuals that have changed their lives and accomplished some great things, that they know they can do some things now. And I think that's incumbent upon the work that we're going to be doing with even our younger participants, because we're talking about grown men who had grown dealing with these same traumas in their life and not having an opportunity to make that changeover. Now we working with them. Hopefully we'll be working with their sons, their nephews in a different capacity, or being able to refer those same younger individuals to Anthony and his team to do that same work. So, one thing about intervention and prevention, it changes along with the youth that you serve. This is my 17th year doing just straight intervention like this. And it's not the same as it was in 98. It's not the same as it was in 2006. Not the same as it was in 2012. We have to change in a way that suits the need of our young people, and we have to meet them where they are. And it was funny hearing you talk about the music aspect. We utilized in our summer enrichment a hip hop component specific to social emotional learning. And to see the kids buy in and really become vested in being able to have their feelings felt through music is phenomenal. That's something else that we're looking to expand on and offer to more young people in the community. As we talked about the millions of dollars that are pouring into the community, I'm happy to say yesterday I filled our chamber of council up with 20 of those partners from the community that'll be getting $4.1 million to better serve the young people within our community. And I'm ecstatic about that.
Absolutely.
But like Dr. Irshad said, I must have heard him talking because I already putting together my RFP for my evaluation. So I recognize without evaluation, I can't have a conversation with him. So we getting all that together right now. I'm very excited about the work that's going to be taking place, and working with the other panelists in their current roles is always going to be special. So I look forward to that as well.
Absolutely. I think, they say music calms a savage beast, right? And so I know one of my strategies when I was a program officer is on the weekends we would do the pop-up barbecues, Wilkins, Joseph, Hudson, Clinton, all those, and then we didn't do them 9 to 5. We did them during the time when the players were playing. That's when we were outside playing, right? And you would have music and you would have food, and it was an opportunity to engage people. And no matter if they were angry that day because the speakers were so loud and we were playing, and the beef hot dogs was on the grill and the ice cream, so it was hard to be angry in that moment. And we have to find a way. You guys talk about the village. We have to find a way to re-engage community in a way that gets their minds off of the fact that 60% of the concentrated poverty of Monroe County is within the 14621 area. So when we talk about violence and all of those different things, the Black Agenda Group has declared racism a public health crisis. I am saying that violence is a byproduct of that, right? And so we have to be addressing all of those things simultaneously, like you stated, Mr. Saunders, and we have to get back to engaging the village again, as you also stated, Ms. Thomas, because without it, we're going to be lost. I have one more question from, I'm going to ask one of the questions from our Q&A, and it says, how can we bring back the village when some parents don't even want you to talk, some don't even like for other adults to talk to their children? Ms. Thomas, you want to answer that question?
That is a problem. We cannot deny that. But that's where the gap, that's where us big mamas that's still around, we got to take a hold to that generation that seem to have been lost and not understanding the value in the village. And we got to get out there and be more intentional about helping to establish those relationships and provide that support.
Absolutely. Chief Steve, what's your thoughts on how do we engage adults who don't want you saying anything to their children? Can you hear me?
Can you hear it, Keith?
I don't think he can hear us.
I'll answer.
Mr. Saunders, can you answer?
I believe that in everybody's life, there is an individual that at one point they have listened to or they're willing to listen to. And I think being able to find who that individual is and being able to tap into that will allow us to be able to address those parents. A lot of times the parents we're dealing with were kids when we dealt with them. So a lot of times, especially in a city like Rochester, it's so tiny. So a lot of times I come across kids and, you know, I would get a referral on a kid. And by the time I see the parent, I know the parent because I worked with the parent. And the parents are the first ones to tell you, oh, you better listen to him. Or you better listen to her. And a lot of us that have been doing this over a period of time, we know the predicates that are connected to these kids. And that's what's important. And that's why I said a lot of times we'll get a referral for that kid. And if the kid feel that they can duck and dodge or you're the only person that's going to be dealing with them, they might not engage you. But if you can go into a household and you know the cousin, the auntie, the uncle, and have frank conversations, that kid's more in line to he'll allow you to build a relationship with them. And in turn, finally have some sense of trust over a period of time that will allow you to help them make positive changes.
Yeah.
You know?
Thank you so much for that. We have another question.
I
Were you going
was
to say
just gonna,
something? Mhm.
yes, I was just going to add to that. It's how you show up
Yeah.
with these. That's really important. That's a key factor in engaging these families in conversations and trying to move the needle forward with addressing some of the issues in the community. It's how you show up. And I'll just briefly say, in the church, there is the mothers, and the mothers, how they would talk to you and they would tell you about different things, like to wear the slip that you should wear under your white dress. How they approached you made all the difference. And I think that's a key factor that needs to be shared, how you show up to these parents.
Yeah, I think that with loving kindness have I drawn thee, you know,
And
and
amen.
I think being and knowing that everyone is different. Times have changed, you know, the way we interact, and we are dealing with what I would say is a parentless generation. Like after the crack epidemic sort of like hit our communities, a lot of our parents got caught up into that. And so I think that we have to be mindful about the way we address young people, because a lot of the elders in their life have failed them. And so the lack of respect sometimes in the acting out that we see is a result of that. So being mindful that when you approach a young person and they may reject you or smell like reefer or whatever, to not be judgmental, right? And because we don't know the story, we don't know the backdrop. And so I think that it's just really important that we look at the way that we're approaching our young people and make sure that the services that are here are what they need. I mean, because I see all the time people come up with new programs. I haven't heard one person say we had a town hall and we engaged the people in this community and this is what they said they wanted, especially when it comes to 14621, because it's so transient. The assumption is that there aren't any stable individuals. My family moved here from Louisiana a long time ago. So 14605 and 21, we have always been in that space. Saying all that to say, we just don't engage that community the way that we should and ask what do you need to be okay? What does your family, what kind of supports does your family need? Now that you've lost the father of your children, now that you've lost your son, what do you do? And so currently, the Greater Rochester Health Foundation, we are supporting Melanie Funches in the Healers Village and working to put together culturally appropriate services, mental health services that will help to support some of these families, and working with Dr. Ershad and Anthony Jordan in collaboration with Anthony Jordan to provide hospital-based services to individuals who have been impacted by gun violence. So saying all that to say, it's really important that we all collectively sit down, map out our resources so that we can effectively serve community, not how we want to serve them, but how they need to be served. We have a question in the chat and it states, how do we integrate healing and building resilience for youth, families, parents, and traumatic culturally responsive approaches, programs, and services? One of the two of you want to,
That
it's a
was a
large
lot.
question. That was a lot. That was
Basically,
Miss Sharita Bullock, by the way. So that's why it was a lot.
well, I think honestly, you had started the conversation by talking about the Healers Village. I think a large component of what we seek in our communities is a culturally competent situation where people are being heard, they're being met where they are. And like you stated, they're having an opportunity to tell people what their needs are, not what we have a need for them to have done. You know, like I state, a lot of our kids in particular, and when I talk to teachers at the school, I would tell them the same thing. I said, you know, a lot of our children are super resilient and adaptive to negative situations. And that can be a good and a bad thing. And the bad thing in a way that our kids are adaptable and are resilient, but a lot of times they can take those negatives and because they're so used to seeing them, adapt it as a norm. And it should never be adapted as a norm. But that's the mechanism that they know which they've worked with over a period of time. And to them, they'd rather look at it as normal as opposed to being a negative.
Yeah.
Well, that's just part of the hood. It's just the way it is. But by the same token, it's a traumatic experience that they haven't yet to recognize is a traumatic experience.
Thank you. Ms. Thomas, anything you would like to respond in any way to that question?
No, thank you.
No, thank you. Okay. Another question we have is, have any of your groups invited the collaboration of the medical community? Violence is a public health issue, and the doctors and nurses in our emergency rooms treat and see all the gunshot wounds and deaths, was a question. I can say that I know that Elder Hanif is looking, along with the bag, they're looking to engage the hospitals in conversation around how we need them to be responding to the needs of community.
Well, we have been attached to the hospital since 2009. We started with the Rochester Youth Violence Partnership, and it was started specific to a situation similar to Dr. Ershad's with a 14-year-old who had been shot within the community 3 times within a year, and he was treated and treated. He was shot, no intervention and prevention was offered, and he was just sent back home. And recognizing that as a problem, we started working with Strong Hospital and is now reached Rochester General. We have a consortium of individuals that go to the hospital as paged whenever there's a shooting involving an individual 25 or younger, I believe is the age. And sometimes it's 585 SNUG that goes to the hospital to address issues. But most times it's Anthony and his team from Pathways to Peace that are paged and can go to the hospital. Because we understand that sometimes during the most traumatic event, people are more likely to be forthcoming or wanting to make changes in their life. And we want to be able to offer them that support at that particular critical time, as well as to the family about what their needs are. Like you said earlier, you just lost your loved one. Your child's laying in a bed in a coma. You don't know what direction to go in. You just want to be in a safe space where somebody's looking out for your needs. And a lot of times our team brings that to the hospital. Now, what the hospital does is Dr. Mark Gestring, who's the trauma surgeon that sees a lot of our gunshot victims, he recognizes that need, and he does a lot to keep on the forefront the work that we are able to accomplish within the building and advocate on our behalf if there's anything that prevented us from being able to work as cohesively as possible with their emergency room staff on behalf of the wounded individual. So yeah, we are connected.
Absolutely. Now, and I know that Dr. Gestring has been there for a really long time.
Yeah.
Do we have a trauma unit at Rochester General or
I
no?
think our only trauma unit is at Strong. I think if they can stabilize them at General, they still take them to Strong.
They still transport them to Strong, because I
Mhm.
know that there were was talks of trying to open up a trauma unit, because I always wondered, like, why would we not have, especially since considering 14621 being one of our historically violent neighborhoods, why we
Yeah.
would not have a trauma unit at, but you're right, if they can stabilize them there, then they send them over to Strong. So we're at the end of our panel, and I thank you guys so much for your time, for your level of expertise, and to your commitment to community and to this cause. I wanted to see before we left if any of you have any closing remarks before we head out.
Anybody before I start speaking?
I think it's only
Honestly,
you and Ms. Thomas left.
I just wanted to say thank you for the opportunity. One thing I can honestly say is being part of the conference for ABC really reinstills in me the community that's available here in Rochester to be able to have these conversations, but not only that, be able to reach out to your stakeholders and partners that you've had for years and hear the voices that matter, such as yours, Chiara, which really means a lot, because you know your sister in the struggle. We see you out on the street with us at our pop-up barbecues. We recognize that, you know, it goes beyond what we do, it's who we are. And it's super important. And I think that with the opportunity for us to open the lines of communication around these discussions, it just pushes us further to be better at what we do. I myself, in hearing Dr. Irshad speak earlier, knowing that I got him on speed dial as well, allows me to be able to move forward working with my team, a team that is now ballooned to where I have 5 coordinators and 4 different separate units within our offices. And I don't have to speak to the value that Anthony brings to the community, not only to my office. And I'm very thankful for the mayor showing us the faith to be able to come out in the community and do the work that we do. So I'm thankful and honored to be able to serve the city of Rochester. And I hope that we continue to have dialogue such as this, and one day be able to answer some of those tough questions that I'd like to be in the middle of discussions with. So
You know, you and I were supposed to hook up for a while now, so I'm going to take you up on that in 2023. We have two statements and a question here before we wrap up. I think since we have your expertise here, Mr. Saunders, I think we want to make sure that we can get these out to you. So one of the statements was, Dr. Graham states, we also need to engage educators in the Rochester City School District and at MCC. I'm at the downtown campus, and we work with the same families, the providers at local health clinics and RCSD are working with. Educational leaders and medical practitioners are key partners, along with those at community-based organizations and RPD. I think you're absolutely right, Dr. Graham, when you say that, again, making a coordinated effort so that we're all collectively talking and knowing what's happening and how we can serve and best support community collectively together and not siloed is what's best. Auntie Mel said, we as the adults in the lives of young people need to work diligently to stop the normalization of the violence and trauma and our young people are experiencing. Just because something happens regularly does not make it normal.
Exactly.
And then lastly, Elder Jockey said, why aren't folks getting the services they need during their time in the emergency room, victims and their families?
you know, we try and streamline those processes in the hopes that we can move beyond some of the issues that the hospital emergency rooms are dealing with. We have had issues previously where you have good emergency room staff that aren't suffering burnout, who have the ability to be able to talk to individuals like they're humans and get the services available to families. And then you have others that treat individuals in the hospital like they shouldn't be there. So, you know, I hear you. I hear your pain.
Yeah, which is another reason why we're looking to roll out the services at Anthony Jordan so that we have more culturally appropriate services of someone who has the acumen around gun violence and understands the needs of the victims and the families. So look out, we'll make sure that everyone gets the information necessary so that they can know that that service is available to community right here on Hudson Avenue, where you can meet doctors that are familiar with community and with the community residents and can provide services from that lens and perspective. Ms. Thomas, before we wrap up, is there anything that you'd like to say?
I'd just like to say I thank Jerome and his team for the opportunity to share in this space. I also would like to just give a plug that in terms of education, the youth at the detention center, successfully, we had 8 youth that were graduated from their home school, which was unprecedented for youth that are in a detention center. So the Monroe County Detention Center is connected to the Rochester City School District, and youth are getting their education and graduating from home schools. I also like to add another plug that through the Youth Bureau, the Youth Family Engagement is a new program which is designed to decrease recidivism from youth that are being discharged from the detention facility back into the community. And that office provides support, jobs, housing, whatever it is needed to help reduce recidivism within our community with our youth. So I just want to, again, thank you for the opportunity to share in this space, and a lot more to be discussed. I'm looking forward to these community collaborative meetings.
Absolutely. Well, thank you guys so much for your time. And again, your expertise. We thank you for everything that you're doing to make our community well and better. I want to remind everyone to complete the survey that's in the chat so that we can know how to better do things in the coming years. I want to thank Mr. Underwood and everyone for putting this panel together and allowing me to be the moderator. And now it's back to you, Mr. Underwood.
Thank you, Sierra, and thank you to our panel.
Thank you, sir.
Vic, always, you know, kindred spirits in the work, who Vic and I share a birthday too, so it was meant to be. Cathy, you know, your passion for this work is palpable. And in both of their absence, Dr. Ershad, and as a matter of fact, irony is something else, because Deputy Chief Stith got knocked out and he was trying to get back in. He and I have been on the phone for the past 10 minutes, and you know, you cannot ignore the irony of the fact that it's our PD system that went down. Why would it go down when we're having this discussion? Anyway, like Arsenio Hall would say, one of them things that make you go, but I was on the phone with the deputy chief, and he's trying fervently, he was trying to get back in on his phone, and so he apologizes for that. But this is something that he and I have had extremely in-depth conversation about, and he's still fairly new to Rochester. He's still learning Rochester, which there's a lot to learn, and he has a really, really difficult job to do. And he knows that. This brother came out of retirement to pick up this heavy load. And there's something to say for that. But we also know that the challenge is a daunting one, and kind of like basketball, you're gonna need the inside outside game. So we're gonna have to support him to do the difficult tasks that he has.